Thank you all for coming today. My name is Dr. Jack Beller. I'm an orthopedic surgeon from Norman, former president of the Oklahoma State Medical Association, and currently serve as chair of the Council on State Legislation and Regulation for the Oklahoma State Medical Association. We wanted to have this information session to provide additional information to the press release we put out today about the Oklahoma Healthcare Authority's plan to further restrict funding for Medicaid health services in Oklahoma. Also with me today from your left to right is Dr. Kent King, a primary care physician, current president of the Oklahoma State Medical Association from Marlow. Dr. Mukesh Parekh, a former president of the Oklahoma State Medical Association and an obstetrician gynecologist from Oklahoma City. Dr. Dana Stone, an obstetrician gynecologist from Oklahoma City. Dr. Dale Askins, an emergency room physician from Oklahoma City. And Dr. Dwayne Kaler, current president of the Oklahoma Osteopathic Association and a primary care physician from Miami, Oklahoma. There's a large and growing number of our most vulnerable citizens in Oklahoma who depend on the Oklahoma Healthcare Authority through the Medicaid program to provide their primary and specialty health care needs. Over 50% of the obstetrical deliveries done in Oklahoma are done through the Medicaid program, with those women receiving their care through the Medicaid program. A large percentage of the future of Oklahoma, our children, receive their basic medical care through the Medicaid program, including their immunizations, their well baby exams, their unique injuries and illnesses. As the press release indicates, the decision to further restrict funding for Medicare services will have a significant effect on access to quality health care for these vulnerable individuals in the state of Oklahoma. And I would like to ask all those individuals behind me to come up and add something to what this means to their practice, and then we will all be available at the conclusion to answer any questions that you might have. Dr. King.
Originally, they had proposed around a 3.25% cut to start in April 1st, and the talk now is to increase that to 6% up to 10%. And this is really not, I'm proud to be from a state that has a balanced budget. I'm proud to be from a state that wants to be fiscally responsible, but when we cut healthcare dollars, for every dollar that we cut, we lose another $3 in federal matching funds. So that's an equivalent of $4 of service, or 4 times the amount of service for every dollar that's cut. And our healthcare system in Oklahoma, as poor as it is, cannot afford that. Hospitals will close. There are doctors that will have to go out of business. Particularly pediatricians and OBGYN doctors will be hit very hard. And specialists will just no longer be able to accept center care or Medicare referrals. We finally had some improvement in the last several years, and we were able to increase enrollment and have more participation by doctors. But this cut, especially in the 6 to 10% range, when the profit margins are either narrow or negligible, will completely devastate some of the primary care specialties in particular. We're losing pediatricians and other specialists out of the state to Texas and other states that have better liability reform, that have better reimbursement, and we're graduating residents and medical students that are rapidly leaving our state, and we already have some severe shortage areas. So this proposed cut, if this takes effect, can be absolutely devastating for access and for the physicians and hospitals of Oklahoma.
My name is Mukesh Parekh. I'm an obstetrician. Currently, the funding and the reimbursement for obstetrical care is pretty low. About 1 in 5, 20% of women still cannot get prenatal care at current level. If if you drop 10% more reimbursement, how many more women will not get prenatal care? I don't have any estimation. I think not getting prenatal care brings more maternal mortality and fetal, and baby's outcome comes out bad. I think this is a wrong corner. They're making adjustment. This is not the place they need to save any money, because otherwise they will pay for premature birth and those small babies in NICU the rest of their life. Those preterm baby cost so much more than we can estimate. I hope Healthcare Authority Board will seriously look at this situation before they implement this decision.
Dana Stone, obstetrician gynecologist here in Oklahoma City. Obviously, Dr. Craig already touched on a lot of our points. The Medicaid patients right now, we are reimbursed at about 70% the level that we're reimbursed by other insurers. So doctors already are very challenged at taking care of these patients at much less reimbursement already. And it's difficult to meet our ever-increasing costs as we're facing these kind of cuts.
Dale Askins, emergency medicine and old ER doc. As we see these cuts take effect, I'm quite afraid that I'm going to see access to these Medicaid patients be denied. Less physicians will accept these patients. They'll therefore show up in emergency rooms all over the state. The other problem we see is when we have someone who's a Medicaid patient, finding a specialist to refer them to if they have an orthopedic problem, an obstetrical problem, will exacerbate considerably by these cuts. So we would recommend that other areas be looked at before we cut access that's so critical to these patients.
Dwayne Kaler from Miami, Oklahoma, do family medicine and is president of the Oklahoma Osteopathic Association. My observation would be these, and I'm going to reflect much of what's already been said this morning. When the Oklahoma Healthcare Authority reduces its budget by $1, it leaves $3 from the federal government on the table. That is a substantial loss to the state of Oklahoma. The next observation would be any business person who stands to lose between 6 and 10% per unit sold is not going to stay in business for very long. Not only will they not stay in business very long, we will not be able to recruit business people in to replace whatever that unit is. Reducing 6 to 10% reimbursement to physicians, you're driving physicians out of business. They're not going to be able to continue to take care of the most needy of population. And I would suggest to you that Medicaid is not the insurer of first choice of most patients in Medicaid. Roughly 2/3 of those dollars are to benefit the aged, the blind, and the disabled. The balance is to help the children that are in need. When unemployment rises, so does Medicaid use, so does Medicaid need. That is the nature of that part of the business. Cutting Medicaid reimbursement only makes the care for those folks less available. Okay?
I'd like to particularly draw your attention to the attachment to the press release, a survey that was done of Oklahoma physicians just this week that indicates between 80 and 90% would either stop accepting Medicaid patients altogether or stop accepting new Medicaid patients if these drastic cuts do come into effect.